Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Carino Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Salah Falodi, and this episode is everything you need to know about anxiety in relationships and couples and what you can do about it and how it shows up in midlife for you. Before we get into it, the first thing I want to make very clear that this is, of course, not any type of medical advice. If you have any questions about anxiety or depression or any of those issues, then please speak with a healthcare provider. And of course, this is not any advice on religions. If you have any questions about your religion, please feel free to go and see your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am super excited to have on with me Justine Carino. And Justine is a therapist. And so, Justine, if you could please introduce yourself to the viewers and listeners out there and tell us a little bit about yourself.
Absolutely. Thank you so much for having me on. I always love talking with you, and I'm excited about this conversation. So, yeah, I am a licensed psychotherapist. I own a group private practice in Westchester County, New York, where we treat teens, young adults, families, and couples. I also have a podcast called Thoughts from the Couch, which is really catered to the ambitious but perfectionistic working mom. And I also have
I don't know who that would be at all.
yeah, we don't know who they are. It's not for me, right? Like I often like say things that I really need for myself. And I also coach women that are struggling with anxiety and stress. I do one-to-one coaching, and I also have a group coaching program that has been designed for the self-employed mom trying to run a business, but also run a family and wants to be present with both her family and her business and is starting to get really stressed out about managing both.
Well, that sounds fantastic and definitely much needed. And offline, I may need to speak to you about those things. But yeah, no. So I would love to talk to you about. Let's talk a little bit about anxiety. So we know that as women go through different points in our life, right, that anxiety and depression can definitely show up, and we know that specifically in like perimenopause and menopause, we see that women that have never had anxiety or depression, those things can definitely show up, and it's due to the fluctuations in the estrogen and the estrogen receptors in our brain. And I'd love to know what you see in your practice. Do you notice a lot of midlife women come to you during this time where they start to feel more anxious, they feel a lot of anxiety come up, and depression?
Absolutely. I mean, there's so many factors that lead to an anxiety disorder. And I also teach the women that come in my office, there's a difference between stress, anxiety, and anxiety disorder. And we kind of have to figure out which is what. I mean, the treatment is very similar, but labeling it and defining it can really help with a treatment plan and help people make progress. So, we want to view stress as there's this time constraint or lack of resources or a sense of pressure to get something done or a lot of things done, and you're running out of the time. But usually when the thing is done, we feel like, whew, I'm glad that's over. I can relax now. With anxiety, it's a lot of jumping to worst case scenarios and catastrophizing. And sometimes the event that we were worried about will happen, but we're still thinking about it. We didn't let it go. We don't get that same relief of like, "Ooh, I'm glad that's done." We still have thoughts of like, "But what if? But what if I did this? What if I did that? What's the worst case scenario? How can I control this outcome?" So that's anxiety. And I want people listening to know, like, both of those emotions are normal. We're all going to have stress at some point, and we're all going to feel anxious at some point. Now, it becomes anxiety disorder when the symptoms of the anxiety are consistent and persistent and are interfering with someone's level of functioning. Maybe it's the ability to focus at work or at home. Maybe you're having trouble sleeping weeks on end. Maybe you are avoiding. Maybe you are having panic attacks. Maybe your behaviors have just really changed and there's this visceral response in your body. So when I meet a new client, I want to assess, like, is this temporary? Is this consistent? Is this persistent? And then what are the causes, right? Sometimes it's hormonal, right? There's hormonal changes due to a life cycle change that the woman's going through. And then I collaborate with physicians to make sure that we're helping this person move forward, right? Sometimes the anxiety could be life events. Something awful has happened, or there's been a shift in your life cycle. Maybe you have a child going to college and that's making you feel really anxious. Maybe you're going through a divorce. Maybe you lost your job. Maybe you have financial stress. Maybe there's this life event that is causing the anxiety. And then the other reason could be genetics, right? If you have had siblings, parents, or grandparents that have also struggled with an anxiety disorder, you're more likely to struggle with one too. And it might be the hormones changes or the life events that turn those genes on and get them activated.
That's so important. And I'm so glad you made all those distinctions, right? Because sometimes when people have stress, they may think that, they have anxiety, but it's probably just, it could just be just normal stress of either something going on at work or something temporary, right? So I'm glad you made that distinction, because I think women sometimes do get confused, right? I mean, not just women, but really people in general may just get confused as to what is that distinction between having just regular anxiety or regular stress and versus something that actually becomes a disorder, right? So I
Absolutely.
think that that's really, really important. So I'd love to ask you and kind of find out, in terms of like couples, now, how does that show up in like a relationship?
Yeah. So, anxiety, if someone's feeling anxious about something in their life or they're struggling with an anxiety disorder, sometimes we actually see it as irritability and frustration. And so, what we see on the surface or a partner sees on the surface is their partner being more agitated,
Mhm.
snippy, snappy, irritable. There's more conflicts, right? And this person on the outside looks kind of mean. It looks like they're really in a bad mood. They're highly reactive, but then sometimes what's underneath that is a layer of stress or anxiety that's not being dealt with.
I
Um,
feel like you just described like 50% of the women that I know, including myself. So I'm like, what? Okay, go ahead. Keep talking.
Totally, totally, totally. I know, and we all do it. And it shows up in families too, right? If you have children and you are trying to get out the door and they are just so slow and they're not listening, and you got to get them to the bus stop because you have a patient at this time and blah, 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 right? You're yelling, you're screaming. You're not actually mad at them, right? You're kind of nervous and stressed out and anxious that your whole day is now going to be thrown off because they're not listening. So, this irritability, this frustration, this rage, a lot of women talk about this rage they get. Sometimes it's tied to a layer of stress and anxiety that's not being coped with.
Hmm. Yeah, and actually I'll tell you that I get a lot of patients that say that they have become like that in midlife, in perimenopause. And again, I have to say that I think it has a lot to do with this estrogen fluctuation. And, when we're not getting the estrogen that controls our emotions, the amygdala that it controls our emotions in our brain. I feel like a lot of women can exhibit that. I mean, in fact, I just had a patient recently tell me, she's like, I feel like I'm not like myself anymore, that I'm yelling at my children. I'm getting really upset. She's like, and it's exactly what you described. She's like, it's not them, but it's just something that's just irritating me. And then it comes off as like I'm mad or angry at them, but I'm not mad at them. And she's like, I don't want to be like that. My kids are like, why is mom mad all the time? And I feel like I see and I hear that a lot from patients coming in to see me.
Absolutely. It's funny you bring this up because, I'm 38. I have a 4-year-old, a 7-year-old, and I am type A and perfectionistic. And if they don't do exactly what I want, when I want them to, I get pissed off. But I would say last week and the week before, I was ragey. And I said to my husband, like, there is something wrong with me. Like I'm a version of myself that I absolutely hate, and I can't stand myself, and I hate that I'm acting this way, and just can't control it. I need your help. I need you to say, walk away, Justine. Like, just get me away from them. Protect our children from me when I'm getting like that, because it feels so out of control. And I can't tell you how many women I work with that can relate to that.
Yeah.
And it
Yeah.
could be these changes that you're describing, that we are
Yeah.
easily emotionally dysregulated. And the biggest takeaway that I talk about with my patients is using mindfulness, like really being so hyper aware as much as you can of like what you're feeling, what you're thinking, where do you feel it in your body, what's going on right now, and be present with that, and then make a choice to react to those feelings and thoughts from your values, right? If you value being a calm mother and you're raging out, you're going to feel the guilt, right? So if you're practicing mindfulness, and I go through a ton of techniques with clients, and it's a muscle we have to build and strengthen, and you're getting better at it, you start to catch yourself and you say, okay, I feel the rage rising. I feel the anxiety. I feel the stress rising. This is my cue to do a coping mechanism so I can calm myself and interact with my husband or my partner or my kids from my sense of values instead of my emotions.
Yeah, I was gonna say, Christine, I mean, that's a lot of thinking, like you have to really be in tune with yourself and really realize that what's happening, it's almost like an out of body experience, right? Like you have to really be seeing yourself acting in a certain way to kind of rein yourself in and be like, wait a second, hold on. That's not how you want to be acting. That's not how you want to show up. You have to really either walk away or do some breathing or, calm yourself down. But I feel like that requires a lot, definitely requires a lot of training. It also requires you to really take time and think. And I feel like when you are upset, I feel like it's hard in that moment to pull yourself away and say, wait a second, I should not be acting like this, and definitely I think as a parent, sometimes when you get upset, you end up apologizing to your child, right? Because you're like, wow, that was not how I meant to be. That's not, how I wanted to sound. So I don't know. I mean, how do you, and I get how you're saying to be more mindful, but I think like in the heat of the moment, it's kind of tough to do that. No?
Absolutely. So I pair the mindfulness techniques with what I call a mental health routine. And so I help every client create a personalized routine that we view as prevention skills. What am I doing? And it could be one or two things every single day, every single week, and every single month that's going to keep me grounded and anchored. So I'm starting to prioritize these skills. So if we're using a scale from 0 to 10, let's say 10 is the highest. If your baseline of stress and anxiety and rage is a 7, a little trigger is going to make you go to that 10. But if we start practicing a mental health routine, you bring that baseline down maybe to a 3 or 4. So it's going to take a lot more for you to be so reactive to get you to that 10. So that's the prevention skills. And that can look like, are you getting enough sleep? Are you getting enough exercise? Are you meditating? Meditation's huge for the mindfulness component. So yeah, when you're raging out, you're not going to go meditate. But the research has showed if you have a meditation practice, even 5 minutes 3 times a week, you start to develop better communication between your prefrontal cortex and your limbic system. What does that mean? It means you can learn to regulate your emotions a lot faster. So it's kind of like, let's say you're a swimmer and you're practicing every week to beat a certain time, right? You're in the pool, you're practicing, race day comes, it's so much easier for you. That's how we view the meditation. If you set a practice to really try and be present, you build those muscles. So when you are triggered and you're about to go off and rage, your brain remembers, I know what to do now. Like I know how to calm myself. I know how to communicate my emotions and take care of my emotions the way I need to. So that's the beauty of it is, yep, if this is day 1 and you're trying not to react in that moment, you're still going to react. We need to set up that mental health routine. We need to strengthen those muscles. We need to practice some meditation. We need to practice some mindfulness. So when you're in it, when you're in the race, you're prepared to react. But if all else fails, right? Sometimes our emotions are going to take over. Our amygdala will hijack our rationale, the reasonable side of our mind. My biggest thing is to walk away. I don't care what you're doing, who you're with. Go lock yourself in a bathroom and calm down. Walk outside, communicate with your partner to give you a cue that you need to like take a break. Your emotions always regulate. You just have to give yourself the time. So if your children's are really pissing you off or your partner's really pissing you off, just stop talking. Stop it. Feel the feeling. Feel how uncomfortable it is and you want to scream. Tolerate the discomfort and disengage and walk away.
It's great. I'm like really thinking about that. So tell me how you meditate. How do you meditate? When I think of people meditating, right, I think of people like just closing their eyes and saying like Om and things like that. I mean, I'm working on mindfulness, so that I know, right? Like I know about, trying to really be present and really focusing on perhaps, your senses or what it is that you're doing when you're mindful. But tell me a little bit about meditation.
Absolutely. So I was really resistant to it for a while. And even in a lot of my training in different modalities, they talked about it. I'm like, this is so boring. I'm never going to meditate and I'm never going to tell someone else to meditate until I realized maybe I should try this out. And then I realized the value it brought to me. So I don't go in meditation looking at, I'm going to sit there for 10 minutes and have zero thoughts and be calm. That's not what meditation is. And that's not what's going to happen to people. I view it as training for the ability to redirect your focus, right? So, being that I treat mostly anxiety disorders, people with high anxiety have ruminating thoughts, obsessive thoughts, intrusive thoughts, worry thoughts that constantly steal their focus and attention. So they could be at work and then they start the worry cycle and then they've just lost it and they can't refocus. So when we meditate, I always encourage people to try guided meditations like the Calm app or Headspace. Go on YouTube and you're listening to someone guide you through a meditation with the deep breathing and the sensations. And then your mind is going to wander, and that's normal and that's okay. But what we want to do is catch it and say, okay, now my mind's wandering. I'm thinking about this and that. Let me come back to this person's voice. Now, in your first meditation, you're probably going to do that 30 to 100 times because you're not used to it. You're developing that muscle. And every time you meditate, you're going to get a little bit better to just listening to that person's voice. Now, you will never be able to be completely still, no thoughts, right? You're always going to have thoughts, but it's the practice of redirecting your focus and attention. Why this is useful is now you're back in your everyday world, managing your anxiety. And then all of a sudden, your focus is on the worry, is on the anxiety. Now you're better because you have that muscle. You're better at catching it and saying, I'm thinking about this again. That's not even going on until next year. Why am I wasting my thought thinking about this? Let me come back to the moment. What am I doing right now? Am I supposed to be eating dinner? Am I supposed to be writing notes? Am I supposed to be with my kids? So it strengthens that focus and attention muscle to the present moment.
Mm. I like that. I feel like it's a lot like mindfulness. What would you say? I feel that the mindfulness practices that I have practiced, there's a book called Positive Intelligence with this author, Shiraz Jamin, and he talks a lot about mindfulness and how to practice mindfulness. And meditation to me sounds a little bit like the mindfulness, about really just focusing on one thing. And then when your thoughts start to, go elsewhere, you bring it back to what it is that you are doing. Would you say it's similar?
100%. I think it's one form of practicing mindfulness. It's under the mindfulness
Okay.
umbrella, and it's just one tool that people can use to practice their mindfulness skills.
Okay. So when you see, so let's just pick on midlife women because those are the women that I see. And you see that they have this, anxiety and these issues with, perhaps coping or, ruminating thoughts and things like that. How do you help them in your group coaching practices?
I target and assess and you do a treatment plan with a few different things, right? So I want to fully understand what are the causes of the anxiety right now. Is it a life cycle change? Your kids are leaving the nest. Did you become a parent? Are you having a divorce? Did somebody die? Where are we in the life cycle phase, right? And with that life cycle phase, your age, does your something about your physical health have something to do with it? Um, is there a genetic predisposition? Is there a major life event? Right. So we want to know the causes. Then I want to know the symptoms. What are the symptoms that you're dealing with right now? What are the targeting symptoms that we're trying to eliminate and work with here? Then I start to teach the mindfulness concepts because people need to know the mindfulness to do the next part I'm going to talk about. So I need people to be able to develop a skill of awareness and consciousness to what they're thinking and doing. Then I slam them with the cognitive behavioral therapy techniques. So, cognitive behavioral therapy is a therapeutic modality where
I
we,
love it.
yeah, right. I love it. It's my favorite.
Yeah.
We help people understand their own relationship between thoughts, feelings, and behaviors. So, all day long, we have situations happening to us, right? Big and small. We then think about the situation, create a narrative, make a meaning, have thoughts about it. And the way we think about that situation is going to lead us to feel a certain way. And for some people, that leads to the anxiety. Just by the way they're perceiving and thinking triggers anxiety or nervousness or stress. And then we want to look at how are they reacting to it? Are they behaving in ways that are actually making it worse for them? And then we have a cycle that we have to start to target and eliminate. So we can't change situations. Life happens, it's out of our control. We can't directly change the way we feel. Our bodies were designed to have feelings. Feelings are information. But we can try and be mindful and think about the way we're thinking about things and try and challenge those thoughts. And we can also behave and react to those thoughts and feelings in new ways that help decrease that anxiety. And then I'm helping them make the mental health routine. I'm collaborating with psychiatrists, other physicians as needed if they need some medication to support, whether it's hormonal balances, whether it's an SSRI, if it's that bad, we get them fully assessed that way. And then I also do a lot of values work, so with anxiety comes a lot of avoidance. And I use exposure therapy and I expose people to what they're avoiding. And exposures can be very difficult and scary for people. So we need to know what their values are that anchor them to get through the exposure. I will give you an example. Let's say someone has a tremendous fear of flying, but their mother wants to go visit Italy because that's where the mother grew up and it's her 80th birthday and she wants to be taken back to Italy. And this woman says, oh my God, I want to be there for my mom so badly. I can't imagine how this is going to happen. I'm not going to take a boat. I got to fly there. We tap into those values. How important is this experience for you? And can we use those values to tolerate how uncomfortable that flight will be to get you there? So we do a lot of values work too. So I kind of use I combine a bunch of different tools, but it's all really rooted and based in cognitive behavioral therapy.
Yeah, no, I think that is fantastic. And I think, I think that cognitive behavioral therapy is really, really important because I think it's really important for people to understand that our thoughts, they come and sometimes, before I did my coaching program and this and that, you would think that like our thoughts were something we didn't have control over, right? That they just came into our head and they just appeared and we just didn't have any control over those thoughts. And then once you realize that you have control over the thoughts that you have and that you can choose to believe if, obviously not make up things in your head, but like, for example, sometimes we imagine things that aren't really true, right? Or we can imagine things like, oh, that person over there, I don't think she likes me, or, she's upset over something, or my mom's mad at me for X, Y, and Z. But that may not even be the case, right? They may be thinking about something else, or they may be preoccupied with their own things going on in their own lives. And you, for some reason, you think it's about you, but it's not about you. It's typically about them and what they're worried about. And so I think that it's really important to see that we have control over our thoughts and we get to choose what we want to have as our thoughts. And then those thoughts lead to feelings. And then those feelings, of course, will lead to actions, right? So if we're angry, right, if we're having a thought that causes us to be angry about something, we might lash out at somebody, or we might not even engage with them because we may think like, oh, this person doesn't like me. And then, so anyways, I think it's super important to know how our thoughts are causing us to behave in a certain way. And if we can change those thoughts, then we can change those feelings, then we can change those actions, which I think is really important.
Absolutely. And to make it even more complicated, right? These automatic thoughts that you and I are talking about right now, they're coming from somewhere. They're coming from what we call our core belief system, right? And we all have these deep rooted subconscious core beliefs about ourselves, others, and the world at large. And they can be positive and they can be negative and they can be neutral. And these core beliefs have been developed over time. They come from our life experiences. They come from childhood interactions. They come from adolescence and they come from our family system. So another part of my training that I love, which is so complementary to CBT, is called Bowenian family systems theories. And that takes a look at your role in your family system that you grew up with, how you behaved in order to maintain peace and homeostasis, right? And a lot of people say, well, I was the parentified child. My dad died when I was 5. My mom worked full time. I took care of the rest of me and my siblings. I was the oldest daughter. That's the role I had, right? Or someone else might say, I was the middle child and no one really paid attention to me. And I became a really big people pleaser to keep the peace and kind of hide. Or I was the baby and I was the princess and I got everything that I wanted and I don't know how to tolerate not getting what I want now, right? So there's so many different family dynamics that lead to the core beliefs, then that lead to the automatic thought processes that we're having on a daily basis. And so we even peel the onion layers to be like, what are these actual core beliefs deep down? Do you have a belief that you have to make everyone happy all of the time. And that's why you're so stressed, because you're so overwhelmed? Or do you have a belief that you're not good enough? So you're still trying to constantly prove that you are, and now you're overcompensating. So it can get really complicated, but it's exciting because in therapy, I do this exercise called a downward spiral that tries to bring up the core beliefs. I have had grown men weep in sessions and say, "Oh my God, you are right. I have believed I am a failure for 50 years. This is the core belief I'm carrying with me," right? And it can do tremendous shifts. So when we finally target and find the one core belief that resonates with someone, that's the change. They're like, "Oh, I'm going to prove this belief wrong. It's not even true." Because most of the time it isn't even true. It's just an interpretation.
I think it's fascinating what you just said. I'd never heard about that family system. What is it called?
It's called Bowenian family system. So Murray Bowen was a psychiatrist who came up with this theory. He kind of looked at it himself and his role in his own family and started putting this to place, and saw tremendous shifts in people's mental health once he started engaging with them within this framework.
Yeah, I mean, I could think like right now, just listening to you, my mind is kind of blown because I'm thinking about, of course, we always reflect on our own childhood and our own issues, whatever. And really interesting what you just said. So I'm going to have to look that up because I think that it absolutely, I think, is so important just to see how people interact and how people deal with certain things and why certain thoughts become a soundtrack in your head, right? And there's that book by John Acuff. I don't know if you've heard about it, but it's called Soundtracks, and it's about how certain thoughts, how rumination happens, and how certain thoughts keep coming through our head, and what are our triggers, and why are they our triggers, right? But it's such an amazing book because he talks about how we can overcome those thoughts and overcome those ruminations, and they start with doing positive affirmations. And so he'll start with, writing affirmations on his with the sticky pad on his mirror in the bathroom, and then start saying those to himself like every single day to change these thoughts that you have about yourself that you think you can't change, but then you really can. And you just have to keep saying it to yourself that this is the kind of person that you are. So I think it's fascinating. I mean, I'm just so fascinated all the time by it, like psychology and psychiatry and therapy and all of that, because I think it's so relevant and so many people can benefit, right? I mean, I think all of us need a therapist, and all of us, could use some type of therapy to help us just become better versions of ourselves, right? It's not like you don't have to have something wrong with you, right? It's just about becoming a better person.
Absolutely. Yeah, I was talking to parents yesterday. They want their teenage daughter to start, and I just commended them because I was like, "Oh, you guys are being proactive and preventative. Like, I'm so happy to hear there isn't a crisis right now, but you're really being thoughtful about what's going on with your daughter, and you're being proactive to help her learn some skills and tools to take care of herself." And you know what? That's the best time. When you are like in a good place and there's some things you want to work on, you have the mental capacity to push yourself and do that change. When you're in crisis, the crisis intervention of therapy takes you a long time to get back to a baseline to then do that CBT work. So I agree. It's a nice compliment to just living your best self.
Yeah, yeah, I think so. I absolutely think so. So, tell me a little bit about what you do, and people, if they are interested in following you, in getting in touch with you, how would they go about doing that?
Absolutely. So I have a website. It's carinocounseling.com. So we provide therapy for individuals living in New York State and Connecticut. That's where our licensures are. I do coaching for anyone, anywhere. So the licensing in the states don't matter for that, which is really fun. I do group coaching for anybody, anywhere. My next program will launch this fall. So all my information about my coaching and my private practice is on carinocounseling.com. I'm also on Instagram at Thoughts from the Couch, and I have my podcast, Thoughts from the Couch.
Awesome. Amazing. So if there were, let's say, like three pearls you were to give somebody as, as they're listening to this and things that you think they absolutely should walk away with after listening to this podcast, what would those three pearls be?
We love that. Okay. One is start figuring out what your mental health routine is, right? What do you need to do? What are two things you need to do every single day to keep your stress down? Is it 8 hours of sleep? Is it waking up an hour before your children? Is it having alone time with a bath? I don't care what it is. I want you to get specific. What's every day? What do you need to do once a week or a few times a week? And what do you need to do once a month? I do have a handout that people can download that can help them figure that out and assess that. So I would say figure out your mental health routine. What can you do to take care of yourself? And it doesn't have to be anything extravagant like a massage. It might just be 30 minutes of peace and quiet, and that's all you need. Two, start paying attention to the way you're thinking about things. What are the narratives? What's the soundtrack, as you mentioned, playing in your head? And how does that relate to your anxiety, right? And number three, if you've been struggling with trying to overcome stress or anxiety, reach out to a professional because it A doesn't have to be forever. B, it could be life changing. And C, you will learn so much about yourself and how to manage your anxiety better.
Well, that was fantastic. So, well, thank you so much for coming on. I really appreciate your time, and I look forward to hearing more about all the things that you're doing. And I know that are you in the process of writing a book?
Yes, I am not any official dates yet, but I really want accessible tools for women who are, killing it in their career and they have big ambitions and they want a family and they want to be present and they feel torn and they have all this stress and perfectionism going on. I want women to have those tools. So that will be coming out.
Amazing. Well, we look forward to it. And thank you so much again for coming on and talking to us about anxiety in relationships and just in your personal life and how to look for it and how to come up with a mental health routine and see how we are talking to ourselves, right? All of those things are so, so important. And, we didn't even actually get into how anxiety affects intimacy, right? I mean, just, I guess, before we go, we should just talk really quick about how anxiety shows up in intimacy. I think that it's pretty awful when it does show up, right?
Absolutely. I think, we have the accelerator and the brake of our libido. And when we're struggling with anxiety or stress, there's a big break that libido really shuts off. And, we can talk about this in so many contexts. If you are someone that survived a sexual assault, you probably have a big break on that libido during certain moments with sexual intimacy. You might have certain narratives that you're trying to work through around sexual intimacy. But yes, anxiety and stress will impact the libido. It will impact how you want to engage with your partner. And it might be a little bit more difficult to feel those old emotions that you used to have. So it really can turn it off. And the good news is we can turn it back on with professionals like you that can help and professionals like me.
Absolutely. And I think what I always want people to walk away with, definitely for my podcast, is that there's hope, right? So there's always someone that can help you with whatever it is that you're struggling with. So you don't have to feel like you're going through this whole life journey all by yourself, that there is hope. There are people, there are professionals that can help you with whatever it is that you're struggling with. And, what you just talked about with anxiety and depression, absolutely. They absolutely affect how you show up in your relationship, how you show up when it's time that if you decide you want to become physically intimate, have sex with somebody, and it absolutely shows up and it can cause a lot of problems, right? We have something what you were talking about with the dual control mechanism, right? There's either inhibitory or excitatory responses, and what you're trying to do is you're trying to decrease the inhibition or increase the excitation. And that what a therapist or a coach or somebody like that can help you with. But then also it's important to note that if you need medication, there's also medication that is available to help you to decrease your anxiety. And I think Justine spoke about that a little bit also earlier.
Absolutely. And never to be afraid to use it. And medication doesn't have to be forever either. It could be for now.
That's right. That's right. It can be temporary. So it doesn't mean that you're going to have to be on medication always, but therapy is always good. Therapy is fantastic. So,
Yeah.
all right. Well, thank you so much for coming on, Justine. And well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about anxiety or depression, make sure you see a healthcare specialist. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.